everyone, welcome to our demonstration. Today we will be demonstrating two exercises to increase shoulder flexion. The first is an exercise using the PNF diagonal pattern of D2 flexion with a resistance band, and the second one is a military press using free weights. To begin with the D2 flexion with a resistance band, the patient should be standing tall with one end of the resistance band anchored under the foot on the side opposite their injured shoulder. The patient's affected shoulder should be positioned in extension, adduction, and internal rotation with the hand pronated. The affected arm should have a firm grip on the TheraBand. The patient should pull diagonally and upward as if starting a lawnmower. The patient should end in a position of shoulder flexion, abduction, external rotation, and the hand supinated. Because this is a strength training program, the exercise should be performed in increments of 3 sets of 10, 3 times per week. The patient should fatigue at the end of each set and therefore rest for 3 to 4 minutes before beginning another set. When choosing a TheraBand resistance, choose the one that causes the patient to fatigue after a set of 10. Increase resistance when the patient can complete the sets without fatigue. Compensations for this exercise can include the following: lateral trunk flexion, trunk extension, trunk rotation, back extension, and lack of eccentric control. Do not perform this exercise with patients who have insufficient trunk stabilization, poor posture, poor eccentric control, poor grip strength, and shoulder impingement syndromes. To modify this exercise in patients with balance deficits, have the patient sit for pelvic stabilization. The next exercise we will be demonstrating will be the military press using free weights.
The military press using free weights begins with the arm at the side in neutral to slight external rotation. The elbow is flexed and the forearm is in a mid position. For reference, the thumb should be pointing posteriorly. To perform the exercise, the weight is lifted from this position to an overhead position. For an exercise prescription for a military press-up, we will use the Oxford PRE regimen, in which the patient completes 3 sets with progressive decreases of 25% of the 10 rep max with each set. First, the 10 rep max should be determined, and in this case, we're going to say it's 8 pounds. The first set will be performed using the 8-pound weight, the second set, a 6-pound weight, and the third set using a 4-pound weight. Between sets, there should be minimal rest periods in order to maximize the strengthening effects of this exercise, according to the Oxford PRE regimen. To estimate this amount of rest time, it should be about the time it takes to switch out the weights. Compensations you should look for when performing this exercise include lateral trunk flexion and lumbar hyperextension. Also, as mentioned before, the patient should have sufficient eccentric control in order to safely perform this movement in both directions. Contraindications: patients that should not perform this exercise include those with shoulder pathologies such as a labral tear, inferior capsule weakness, or if any impingement symptoms exist within the arc of the range of motion. Modifications that can be employed for patients with core weakness or balance problems include sitting. This will automatically stabilize the patient's pelvis. If needed, further stabilization can be given by adding a back support. Thank you for watching our presentation on how to increase shoulder flexion strength in patients.
Thank
Have a
you.
good day.
Thanks.